Yeah.
All right, I'm speaking with Dr. Somil Viradia right now. First off, just tell us a little bit about yourself and where you work.
So I'm a hospitalist working in the central Los Angeles area, working in 2 different facilities over here, like I said, in the Los Angeles area.
All right, you're a doctor there. Now, I first heard from a colleague of yours about this issue. She wrote to me with some concerns about the lack of PPEs, personal protective equipment that have been in hospitals. And we've heard a lot about that lately. But what she was saying now, staff are being told to work without a mask, even though they sometimes have known exposure to COVID-19 patients. Is that true? Has that been your experience?
It hasn't been my personal experience in the facilities that I work at, but I have heard from other doctors that they've gone to that same scenario.
Is that something that you're concerned about as a physician, hearing this type of story?
I'm concerned about us not having enough PPE in the right situations, and I think that what other doctors are experiencing, where they're being told not to wear it, is due to the fact that there aren't enough kind of protective equipment for providers, essentially. And so I'm really more worried about the supply of it and the after effects that manifest as a result.
She had mentioned that there are doctors and nurses who are basically wasting or spending what could be valuable time with patients looking for these things, searching different locations for them. Is that something you've experienced as well?
Yeah, I mean, once the patient load increases and time becomes an issue, yeah, that will become more and more of an issue. I think right now in certain areas, like in the Los Angeles areas, the load of COVID patients hasn't really hit its peak yet, and so I think there's been time, but as it starts to increase, that will definitely be a factor.
So are you hearing that the peak time would be around mid-April at this point as well?
That's what's predicted by all the models and the graphs and everything like that. So I would assume maybe, yeah, within the next 1 to 2 weeks, we might start to see more of an influx of cases. When the actual peak will be, I'm not sure exactly what the data predicts, but I expect it to be around there.
She also said that there are some administrators, she said this was sort of her last straw of how upset she's been about this, but she said some administrators are telling staff that they'll actually be disciplined if they're caught wearing a mask when they're not seeing a confirmed COVID patient. Have you been hearing about cases like this as well?
Like I said, yeah, I've heard from a couple different providers that has been the case, and they're kind of afraid to fight back against that because as physicians, we generally try to be courteous and professional, and doing something like going against administration is not something that a lot of doctors are comfortable doing. And so, yeah, I have heard a lot of them are afraid of, in terms of their job position, and speaking up about it is something that they're also afraid of because of the same reason.
And yet you're speaking up right now. Tell us why. What are your concerns about this, if this is taking place?
Well, yeah, I mean, regardless of your job security, at a certain point, your own physical health takes precedence and is more important than any of that. But my main concern is that one, for my fellow doctors and nurses and therapists and hospital staff that all work there, potentially our lives and our physical well-being is being put on the line. But also, I think it's going to reach a point very quickly where if we don't have the protective equipment needed, then infection could very quickly spread among staff. And if they start getting sick or they start having to quarantine themselves, you're very quickly going to run out of staff and numbers of staff in order to treat patients adequately. So even though we're doing all this social distancing and America is sacrificing tremendously, the key point or the key link in that is actually having enough staff. And if they all get sick, very quickly the numbers needed to treat will go down tremendously, and then we won't be able to treat patients adequately.
And that could be catastrophic, couldn't it?
Oh yeah, potentially. Honestly, I believe that once the cases start rolling in, and it's only a matter of time when the staff starts getting sick, I think really probably in 2 weeks or so, you could potentially see a massive collapse of the healthcare industry's ability to actually treat for patients. And that would be a crisis within this crisis that we're already in.
Tell me also, I hear that New York is running very low on ventilators right now. and that there are several hospitals that have actually reached capacity. Is that a concern as well across the country?
Yeah, I don't know the specific numbers in ventilators in New York City, whether they're actually at that capacity or not. I mean, that is the concern of why social distancing is being implemented right now, to allow, the healthcare system the opportunity not to reach capacity. And so that's the concern in terms of preventing it for the future. I think here in the Los Angeles area, from what I've heard from other doctors, is that they've not really reached that point yet. They're still kind of just getting the first couple cases of coronavirus that are confirmed and having some beds in the ICU start to be for that. But overall, in terms of capacity here, what I've heard personally from my friends is that they haven't reached it yet here.
Now, during a press conference today, we heard that HHS is, Health and Human Services, are planning to buy about 600 million more N95 respirator masks. They've been ordered. They're coming in over the next 18 months, and they're going to retrofit factories to make them. 18 months is a long way away. You're talking about possibly 2 weeks away of being catastrophic. Is that enough, what they're doing?
I mean, yeah, I don't know. I don't know how quickly they can get the first batch out here. And in terms of the 2 weeks, that's not something that's been studied or polls that I've heard or anything like that. I'm just going based off of what I know from my personal experience working here, speaking with friends personally, and also speaking with lots of doctors from other areas. I just feel that it's only a matter of time, and it's going to happen quicker than we think. But I think what the kind of intermediate solution is going to have to be, we find a way to just reuse these masks, hopefully in as sanitary of a way as possible. May not be ideal under regular circumstances, but in this kind of pandemic phase, it may be all we got while we wait for more masks to come in. I know a lot of doctors, and myself included, have actually crowdsourced on Facebook asking people to donate masks. I think it's a growing trend, and I had to get friends who gave me websites where you can buy masks just like a normal civilian would, and then I had to go and tell hospital administration where they can buy masks, and then they bought masks on the same website that my friends were.
So you as a doctor are having to go on Facebook to look for masks, is what you're saying?
Yeah, well, I go on Facebook to get sources where I can buy masks, because people know they're searching for the masks themselves as like non-medical personnel, and then they tell me, they give me the hookup, and then I go there, and then I let kind of like hospital administration know, and then they've also gone there as well because they weren't able to find them themselves.
There was also something mentioned during that press conference about making some very difficult decisions that doctors, federal officials will have to make about who gets equipment and what kind of equipment and who doesn't. Concerns about that coming up?
Yeah, I mean, like I said, that's one of my main concerns, is like similar to how certain nurses or like in medical staff were being told not to wear them. Really comes down to an issue of supply. When you don't have supply, you have to start making hard decisions. Sorry, let me walk away from this noise over here. But yeah, I mean, you started making hard decisions, which is not something that you would typically ever ask a medical staff to make about themselves. You may have to start making decisions about patients, but I think we're all in uncharted territory when the actual nurses and doctors are being asked to make decisions about their own health and safety because of.
Before we close, I just have one question. What's your greatest worry from this PPE shortage for the future here?
Like I said, my greatest worry personally is, possibly getting infected and then having a potentially negative outcome. I mean, we are hearing cases. I don't know exactly what the rate is, but there's some cases of doctors dying or being in intensive care from this. In Italy, I believe there were like 17 doctors that died over there, and that's not even including nurses, which I don't know the number of. But for me personally and my family, I mean, that's something that's considerable concern. And obviously I have a lot of medical friends and doctor friends and nurse friends, and we're all at risk potentially.
Dr. Somil Viradia, we want to thank you so much for taking the time and wish you, your colleagues, the best, and to please stay safe.
Thank you. You as well.